Hi, I'm Ruth Werner, and I'm so glad that you have decided to join us for this short video in which I can share some excerpts of my conversations with some of the people I consulted for my article, Trauma-Informed Care, Walking the Path of Client-Centered Connection and Collaboration, which appears in the May-June 2022 edition of Massage and Bodywork magazine. I had long and complicated conversations with each of these wonderful subject matter experts, and I extracted the pieces that I thought were especially important because they come from the perspective of people who are actively working with and serving individuals who have been affected by trauma. I loosely broke these snippets into some main themes. One is about healing relationships in trauma-informed care and what that looks like. One is about appropriate roles for massage therapists, about creating a sense of safety for ourselves and our clients, especially when an emotional response happens during a session. And one about practical application and what healing from trauma might look like. Our contributors include the wonderful Pam Fitch, registered massage therapist from Ottawa and author of Talking Body, Listening Hands, A Guide to Professionalism, Communication, and the Therapeutic Relationship. I also was honored to chat with Dr. Susan Rama, professor at Kent School of Social Work and Family Science at the University of Louisville. Dr. Rama is also a senior advisor and lead trainer for an organization called Tip It Forward. Another contributor was Kamalitha Livingstone, a massage therapist who is the founder and director of Tip It Forward. This is a nonprofit organization that delivers trauma-informed whole healthcare services through mobile wellness clinics to underserved and under-resourced individuals. And I spoke with Sahara Piri, massage therapist and parent educator, who puts special emphasis on how life experiences, especially about trauma, are held in the body and how that influences our lives and our behavior.
The major driver in trauma-informed care is that they're the center of the treatment, not the provider. And I think when it comes to massage therapists, we often want to save people from their experiences and from their disease states and believe that massage can solve everything. And so it's really important that massage therapists know the limits of the work and that the massage therapist isn't the center of the treatment.
I think that the most dangerous thing that massage therapists, the trap that they get into, the most dangerous trap that massage therapists get into when they're working with clients who have a history of trauma is thinking that they can be everything that that individual needs. And we need to tighten up our skills on saying, these are my limits of care. And this is what you need. And it might not be me right now. Maybe you need to go talk to somebody for 3 months and then come back and see me and we'll try this again. But massage therapists, in my experience, we want to be nice, we want to be kind, we want to be all things to all people. And we don't have a very good track record of saying, I can't see you right now, given what's going on. I think that's the trap that leads you into so many problems down the road.
So you just said something interesting. You talked about what it means to be in a healing relationship and how you felt that you and Kamalitha sort of resonated on that. What does that mean for you?
In our Western culture models of, certainly in psychology and social work, our focus has really developed to fix things rather than to engage in relationship as to accompany a person in their healing process. My background and my experiences have led me to really be very clear that I'm I'm walking alongside somebody in that process. And my job is to, provide some guidance, suggestions, support, but really to engage that person in a way that allows them to identify and understand what they need and support what they need, help their voice to be drawn out from their own experiences.
Yeah.
But it doesn't mean that we can't work with people who have histories of trauma. We just have to have this dead certain idea of what our role is. People used to say, just let it out.
Mm-hmm.
Yeah. If a client felt like they could feel the tears coming, just let it out. You're safe here. No, you're not. You're not safe with someone who has no training in managing psychological states of being. That is not part of our training. We might be intuitively solid. We might be good, but there's no guarantee. So it's actually not helpful to say, just let it out. I totally disagree with that.
What would you say instead?
Where does this show up in your body?
Nice.
How are you feeling this emotion in your body? Because I can work with the body. That's my job. But maybe if you need to talk about it, maybe I could help you find somebody to do the conversation with you about what's happening. That creates a very clear delineation between what I do and what a psychotherapist, psychologist, physician, or somebody else who does talk therapy might do. That's not my job.
Yeah, and that safety is, people tend to look at safety as kind of face value, and safety isn't face value at all. Safety is an internal experience.
Yep.
And, and it drives behavior. The other piece to safety drives behavior is that often it's very unconscious on the part of the person who's feeling unsafe. I mean, it doesn't register as I'm not feeling safe, so I'm going to do something here.
Right.
Right. It's not a cognitive behavior as much as it is a protection. And we just do things.
I have a friend who offered chair massage at an event for veterans. And it was a big open room, lots of people around, sort of a public setting. So she figured that would, it was just chair massage, easy. But she set up her chair so that she could look out the window while she was working, and nobody came to her because nobody wanted to have their back to the
door.
Yeah. So she turned her chair around, and then she had a line of people waiting on her chair. That kind of subtle adjustment.
Exactly.
Makes a huge difference.
Yeah.
For massage therapists, I think what massage therapists need to understand is they need to understand that there is a cognitive connection to those physical sensations, and then be prepared with some tools if somebody has an abreaction to something that they do. So knowing what kind of language to use, but language is going to be the last thing that if people are having a physical reaction, a trauma related physical sensation, the last thing they're going to be able to connect to are words.
Right.
And so I usually am dealing with the talk therapist, trying to help them to stop talking because their talking isn't doing any good. And you're asking me to think about, from the other side, the folks that are doing the body work. In that case, they don't need to use the talk side because that isn't the most helpful thing, but rather to come at it through knowing how to use the body to create comfort and to bring them back to safety. And so those are our grounding techniques and bringing the body back into itself, trying to pull the person out of the trauma brain.
When you say grounding techniques, can you tell me a little more what you mean by that?
Right. When we've gone to the future or the past and we're not in the present, what helps bring us back into the present moment is connecting to the senses.
Mm-hmm.
So smell, taste, hearing, sight, feel. And so grounding techniques are things that help a person come back into that, into this present. And so a firm hand on the back, feel my hand, hear my voice, listen to the bird sounds on the sound machine. I guess what I'm suggesting is that every massage therapist should know how to use that technique, because it isn't unusual for folks to go to some place that's that some body touch that brings up emotion.
Right. And rather than like urging people to go deeper into that, really, it's our job to bring people back to the present.
Unless you're really trained to do that.
Right. Thank you.
Yeah.
So if I have an Indigenous person who comes in to see me and wants to receive care, my responsibility as a therapist is to be aware of the potential for generational trauma. But I'm not going to ask if their grandmother was traumatized, right? It's so there's a trauma-informed care also implies that I am taking responsibility to inform myself about what the research says, what social issues might contribute to trauma, and all of that kind of thing.
I like the use of universal precautions. I've used that at times because we should be, no matter what we know or don't know about a person, we should be engaging them with the basic premises of providing safety, being mutual in our process, having a basic humility about, because there's always things we don't know. There's always parts of a person that impact how we care for them. There's always parts that we're unaware of. We should never make any assumptions.
I also believe it's a bit of a generational thing. The longer you've been in massage therapy, the more sensitive you are to those issues, because the more cow patties and quicksand you have stepped into and don't want to step into again, right?
I work with I've worked with a lot of torture survivors, a lot of survivors of human trafficking, and there's definitely a complete disconnect to our bodies. It's survival. That's how they survived.
Right.
Was that disconnection. And so how do you ease a person back into that is a very gentle and careful process that doesn't happen overnight. And that's another part of the challenge, is that it takes a period of engagement to create the safe space that allows that to happen.
So if I understand you correctly, it sounds like your perception of what healing trauma means isn't that a person never has another debilitating memory again. It's that they learn how to cope with those experiences and not be sidelined by them. Is that fair?
Yes. And
nice.
For some people, those things disappear. But if you're talking about serious, I just mentioned the kind of people that I've worked with, they're not going to forget the things that happened. Yeah. They have to learn how to live with their bodies and continue with that continued memory and that history. And so managing the affect, understanding what's happening, managing it, and then creating a life that allows them to live comfortably with all of that.
There are so many people that I know that have been, have gone through traumatic experiences and have come out the other side, and they are capable, creative, wonderful, kind human beings that have lots to offer, and some terrible things happened.
Thanks again for joining us for this short video. I hope you found it helpful and hopeful. I've been deeply inspired by this topic, and I hope you have too.